Well, David, this is Pacific.ca. It's a program on community television from the Pacific coast of Canada. And I understand you were an MLA a while ago. You were in cabinet or a critic of health?
No, I was an MLA 91 to 96. And if you look at my resume on my website at strategicthoughts.com, you'll see that I spent a good deal of my career working in healthcare. I did my PhD in economics and did some work in health economics, worked on establishing the first pharmacare program.
Yeah, now tell me, what was that program you said?
I worked on establishing the first pharmacare program
Okay, you established the
back
program.
in the 70s.
Uh-huh. And what is exactly is that?
The pharmacare program in the 70s was announced by the NDP government of the day to provide coverage for seniors for prescription drugs.
All right.
Today,
Okay.
we have something called universal pharmacare, and everybody pays a deductible that depends on income. That unfortunately has a deterrent effect, and some people do not fill their prescriptions, do not comply with what their physician recommends because of the user fee element that exists today.
And the user fee is mainly because of the BC Medicare insurance?
Well, pharmacare is separate. The BC Medicare insurance, as you call it, its historical roots is just to cover physicians and surgeons services. The entire health package, of course, involves much more than that, especially hospitals and pharmaceuticals. Pharmacare is part of the Ministry of Health, and it covers some of the pharmaceutical expenses.
For seniors.
Well, now it covers for everyone. And if you're not registered with Universal Pharmacare, you should go to the Ministry of Health website and get yourself registered, because you never know when you're going to need the program, and there's no premium or fee attached. It's a benefit of citizenship in British Columbia.
Okay, let me tell you what I've heard from other people is that the medical insurance, BC medical insurance, is a regressive form of tax, and that BC is perhaps one of the only one or two provinces in Canada that has it. What's your opinion?
It is now the only province in Canada that funds part of healthcare with what's called a premium, or more rightly called a flat tax. You pay the same premium whether your income is $40,000 a year or $400,000 a year. You and Jimmy Pattison, the billionaire, would pay the same premium. Now, there is some premium assistance for people with incomes lower than about $30,000 a year. But for all practical purposes, it's a flat head tax, one of the most regressive forms of tax you can possibly have. In British Columbia, we keep it, and we not only keep it, but the Liberal government has been increasing it at about 6% per year when inflation's running at less than 2% per year. So they are relying more and more on that bad form of taxation.
But and the NDPs were in power for quite a few years, 10 years or so, when you were in MLA. So why did the NDPs not cancel it or change it?
Well, what happened during that time was it was, for most of those years, frozen. So the premium was bringing in less and less as a proportion of the total healthcare costs during those years. But then when the Liberals got in power, in one fell swoop, they increased it by 50%. They increased it by 50%. Some pension plans, particularly public sector pension plans, that were providing MSP premium payments as part of their pension benefits, said they could no longer afford it, and they eliminated that benefit. That happened with most municipal workers, teachers, healthcare workers, government workers. It was all eliminated. The problem with phasing out the premium in British Columbia is it raises over $1 billion per year. So if you eliminate that $1 billion, you have to get the money from elsewhere. Hence, eliminating it is best done in a phased manner, the way the NDP was doing, by essentially freezing it and letting inflation gradually eat it away till you can deal with it. But the Liberals reversed that policy, and instead of gradually phasing it out, they've relied increasingly on it.
Okay. Now, we have a poll called nowpolling.ca. I don't know if you've ever been on that site. And if you go to the provincial government, the Minister of Healthcare Services, and you go to how to pay for healthcare services, you'll find that 90% of the few participants actually want 100% paid by taxes. I wonder if any government is going to listen to those people, to the people, the majority of people that want 100% paid by taxes.
Thanks to your email, I went to that website. I'm disappointed that fewer than 30 people answered any of the questions, so it's not exactly a large sample scientific poll. And they are and they, and they are self-selected. Nevertheless, I appreciated seeing that virtually all of the answers corresponded with my own biases. It was as if I had answered the questionnaire. And look, all of the country, save British Columbia, healthcare is entirely paid by other forms of taxation. It's only in British Columbia we use this premium tax, a flat tax, and it should be eliminated. I don't think that's going to happen in my lifetime now that Christy Clark got back in as premier.
So if the majority of the people want actually to pay the healthcare paid 100% by taxes, and the governments, the representative politicians, are not doing what the people want, who are they representing?
Well, you'll have to ask the people who voted Liberal because it was well known that the Liberals would increase MSP premiums by more than the rate of inflation every year, and they got the most votes.
So we are doomed with this type of government that does not really represent the people. Is that what you're saying?
It's on the issue of MSP premium taxes. The government policy is clear, and the government got reelected. I think that's very unfortunate. It's unfortunate, in my opinion, that they got reelected. It's also unfortunate that they embraced that flat tax, but that's the way it is.
Well, there is another topic on nowpolling.ca, and a few people again have gone and participated in it. And under provincial government, you go to the Minister of Healthcare Services again, and the question is who should provide it? Should public services be provided by public workers, or should it be privatized?
For as long as we've had what we call Medicare in Canada, the provision of health services has been from a mix of self-employed people, privately employed people, and publicly employed people. Most physicians don't work for the government. They are independent business people. Pharmacists don't work for the government. They are independent business people or employees of a pharmacy. Dentists are all, by and large, self-employed, independent business people. Medical equipment manufacturers are all private. So we have public employees, by and large, running hospitals, but most of the rest of the healthcare system, save for some health administrators in Victoria, are actually private sector workers. Now, we run into this debate, particularly in the area of long-term care, where the policy of the government in long-term care has been to increasingly break union contracts and contract out to private sector firms to provide labor services. But when you look at the broad sweep of all health services, it's always been a mix of public and private. Where it becomes, what's important to separate is the issue of whether a worker, be it a physician, a neurosurgeon, a dentist, or a janitor in a hospital, whether they are on the public payroll or private payroll, what matters most is, are they paid for publicly or privately? You can have a physician who's a self-employed individual, but paid for publicly through Medicare. Likewise, you can have a physician in the False Creek Surgery Center, which is self-employed, but they are paid for out of your own pocket.
Okay, so it's kind of the foot in the door for privatizing, because it all depends in the end what the degree of private investment is and what a degree of public investment is in it.
It has always been a mix of the two,
Hmm.
and we always have to fight to maintain the public health insurance. There have always been those in Canada that have not fully accepted and embraced Medicare.
Well, I, I've heard commentaries to the effect that right from the beginning, from Tommy Douglas, the problem was that they didn't make it 100% public, that they allowed the small entrepreneurship to be part of the health system, which is the private practice, right?
A lot, a lot of people would argue that point of view. Although, if you go back and read the history of the development of Medicare and look at the doctors' strike in Saskatchewan, I think most would say that Tommy Douglas accomplished a lot more than most gave him, most thought he would be able to accomplish. He was virtually run out of the province after introducing Medicare after that bitter strike by the doctors.
Hmm. But you don't think it was a mistake then, like some people do, that he allowed the private practice of doctors?
He accomplished as much as was humanly possible. There was a
Yeah.
lot of resistance to what he was doing.
Yeah. No, I realize that he accomplished a lot of something that nobody did before. But still, some people think that he didn't go far enough.
It was not possible to go farther because of the
Okay.
political resistance of the day.
And
It's not a question of what is theoretically the best system. It's a question of what's attainable.
do you think today, in today's society, is it attainable?
Bill Bennett in the 1980s introduced in BC a publicly financed dental program for children.
Yeah.
That lasted a year and a half and it died because it proved just to be too expensive, and there was no public outcry when they ended that program. So right now, no one's talking about publicly financed dental plans. The most we can hope for is some sort of national pharmacare program. The likelihood of that is slim and none with the Harper government. And we have to fight to hang on to what we've got in terms of Medicare and hospital insurance and stop the erosion through increasing privatization and queue jumping.
When you say it proved to be too expensive, who would pay for that expense? Isn't it the taxpayers that pay either from their own pocket to the private dentist or through taxes to a hospital that also has a department of dentistry?
That's absolutely correct. And what happened in the late 80s when BC had that children's dental program is the government at the time was actually was I think the early 80s, around the 83 restraint period. In any event, the government was slashing programs left, right, and center, and the dental program was one of the ones that was cut. And there was no public outcry because of it.
How do you measure that public appetite? If we don't have a poll or like what I'm trying to do with nowpolling.ca, isn't it just the opinion of politicians? They say people can afford it. I've heard a lot of NDPs actually said, oh no, the budget will not allow us to do that. It's like the budget is a person, a god somewhere that decides on the social services. And they say, we can't afford it, as if the money comes from the politicians' pockets. So how do you know that the people didn't have the appetite for it?
Because in the case in the 1980s, when the children's dental program was eliminated, there was no public outcry at all, no complaints, no resistance. They went right along with it. And I'm not condoning it. I'm not saying that was a good thing. I'm saying that was the political reality. And in terms of the political reality, you unfortunately hear more people complaining about taxes than you hear people saying, let's make sure our healthcare system is more comprehensive and more universal. It takes a lot of effort to build support and understanding for public health insurance. You cannot take it for granted. Right now, we have people jumping the queue and having private surgeries done, paying for it out of their own pocket. And too many people see no harm in that. But the harm is that it will drain doctors away from the public system to the private system. It will allow the public system to allow the waiting times to get longer because they simply say, well, if you don't like it, go over and pay out of your own pocket. All of that is harmful to our public healthcare system.